Hi class, this video will cover will be a very brief overview of the heart chapter. This is a long chapter that has a lot of anatomy and physiology in it. But what I like about this chapter is it has a very common thread that ties everything together. So even though there's a lot of information here, a lot of new stuff, it is a challenging chapter. If you keep this core concept, this common thread in mind, it will help you make sense of everything that you're going to read about, because it kind of gives you this anchoring point, so something you can always come back to. So of course the chapter itself is very long. This video is going to be comparatively pretty short, but I think you will find it helpful just to organize your thoughts as you're going through and trying to organize your thoughts as you're trying to go through and just understand this information, kind of create a framework for you to put it in your brain, a good filing cabinet, good filing system for you to put information in and then be able to access it. So when we look at the heart overall, so this is part of the cardiovascular system, so when we look at this organ of the cardiovascular system, this is the guiding principle. All structures of the heart function to ensure one-way flow of blood out of the left ventricle. You see what I underlined here? This is that kind of core concept of this entire A&P class, why you are taking anatomy and physiology. Anatomy is structure, physiology is function. So you see this tied in very clearly. Remember, all structures in the body have specific functions. So when we look at the heart, every structure you will encounter in the heart functions to ensure one-way flow of blood out of the left ventricle. So this one-way flow of blood out of the left ventricle is measured in a concept called cardiac output. So this is called cardiac output. You can see cardiac output, the equation is heart rate times, should be, we'll go ahead and change this up right now. Cardiac output equals heart rate times stroke volume. So heart rate is a frequency, stroke volume obviously is a volume, it is an amount. So cardiac output is an amount per unit time. Specifically, cardiac output is the volume of blood measured in either liters or milliliters. So the volume of blood the heart pumps in 1 minute. So when you do heart rate times stroke volume, you get a measurement called cardiac output. So all structures of the heart function to ensure one-way flow of blood out of the left ventricle. If we tie this into homeostasis, it means that all structures of the heart function to ensure adequate cardiac output to meet the demands of the body's tissues at that time. So when you look at this very simple sentence, this very simple concept, it functions like a map. So it's kind of the X marks the spot here, functions like a map. So when you are reading this chapter and you get to a concept that you are struggling with, that you just want to throw your book against the wall, that you want to give up, that you're just questioning, I don't know what this structure does, I don't know why it's here, I don't know, I'm just having a hard time understanding this topic, you always come back to this sentence. All structures of the heart function to ensure one-way flow of blood out of the left ventricle. So if you ever get lost, you say to yourself, self, how does this structure function to ensure one-way flow of blood out of the left ventricle? To kind of say this another way, you should never completely not know the function of a structure. You get to a structure, you can always know that its main function, whatever that structure is, a heart valve, muscle tissue, a papillary muscle, whatever it is, you already know going into it that its main function is to ensure one-way flow of blood out of the left ventricle. So to understand this sentence and how all of these things work together, I kind of summarize the heart with 3 fundamental concepts. So to fully understand how structure matches up with function in the heart, you need to understand these 3 concepts. You need to understand EKG and the cardiac cycle. You need to understand the blood pump, that the heart is a blood pump, and pressure gradients. And then you need to understand the blood flow pathway. And you can see obviously the blood flow pathway ties into one-way flow of blood out of the left ventricle. So concept one, we'll look at these in a little more detail coming up. EKG and the cardiac cycle. EKG, electrocardiogram, or ECG, that represents the electrical events. The cardiac cycle represents the physical events, the contraction of the musculature of the heart. So this first concept is you need to know that electrical events cause physical events. Action potentials cause muscle contraction. So the terminology that you're going to read about in the book here for the electrical events is depolarization and repolarization. And the physical events, the terminology is contraction and relaxation. Specific to the muscle is, to the cardiac muscle, is systole and diastole. So you see depolarization, which is an electrical event, leads to systole, and repolarization, which is an electrical event, leads to diastole, which is the physical event, the physical relaxation. Fundamental concept number two is understanding that the heart is a blood pump. Specifically, the heart, even though it's one organ, actually is two pumps. You have a right pump and a left pump, and you need to understand how the heart's ability to pump blood is dependent on pressure gradients. So to fully understand this fundamental concept, you have to know the difference between atria and ventricles. Those are the chambers, the different chambers of the heart. And you also need to know the functional difference between the right side and the left side of the heart. So you have a right atrium and a left atrium, you have a right ventricle and a left ventricle. And then once you've understood concept one and two, you then can put it all together to summarize it as the blood flow pathway. So let's look at number one, EKG and the cardiac cycle. Remember, electrophysiology, which is the EKG, causes mechanical physiology, which is the cardiac cycle. And we can tie these things together. We can tie these things together by looking at the cardiac cycle. So remember, it's the electrical events that cause the physical events. And remember our terminology, depolarization versus repolarization, and then how that leads to systole versus diastole. Okay, oops, so here we are. So when we look at this, you can see this circle here represents the cardiac cycle. And since it's a cycle, it's arbitrary where you start, but you need to know that we can combine these terms with the atria and the ventricles and systole and diastole. So for the heart to pump effectively, all of these chambers need to contract in a coordinated cycle, in a coordinated pattern. And so I'm not going to go into a lot of specific detail here because that's what your book is going to be for, and that's not really the purpose of this video. But I want you to see that there is a relationship here. We start here at atrial systole. So let's start here at atrial contraction, and then you can see once it contracts, it moves into atrial diastole, which is atrial relaxation. And you can see how that's coordinated then in a precise pattern with ventricular systole and ventricular diastole. So you need to really spend some time understanding the relationship between when a heart chamber is resting and when a heart chamber is contracting. But the takeaway here is what causes the atria and the ventricles to contract and to relax? Well, remember, it is the electrophysiology. It is the electrical events of the heart. And so your book will go into some more detail about what those electrical events are. So when you think about the EKG and the cardiac cycle, you need to realize that first you have the electrical events, and then those lead into those physical contraction events. What's the purpose of the physical contraction? So the physical contraction comes from the electrical stimulation, but what is the purpose of those physical events? What is the purpose of contraction? So this leads into step number two, which is the blood pump and the pressure gradients. So you can see I have a picture of a water bottle here, and we know how if you want to squeeze water out of a water bottle, or if you want to get water out of a water bottle, you squeeze it. So when you squeeze the water bottle, you decrease the volume, as you can see here in the image. When the volume decreases, pressure inside the water bottle increases. Thus, it creates a pressure gradient and water shoots out from the area of higher pressure inside the water bottle to outside the water bottle. This is called Boyle's law. Boyle's law states that volume and pressure are inversely proportional. So as I said here with the water bottle, when you decrease volume by squeezing the water bottle, you increase pressure inside the water bottle. Thus the water shoots out. So this is where we get this concept of pressure gradient. So relate it back to what we just looked at. What's the point of atrial systole, atrial diastole? What's the point of ventricular systole and ventricular diastole? Contraction and relaxation. As you can picture, contraction and relaxation are changing the volumes. And when you change the volumes, you change the pressure. And when you change the pressure, you create pressure gradients. And those pressure gradients cause the blood to flow. So to kind of summarize what step number 2 is, we need to go back to understand the atria and the ventricles, that these are both, that one set are receiving chambers and one set are ejecting chambers. So when they contract and relax, you need to know functionally the atria, whether it's the right or the left, receives blood, and then the ventricles, whether it's the right or the left, ejects blood out of the heart. So the atria are the heart's receiving chambers, blood receiving chambers, and the ventricles are the heart's ejecting chambers. When you coordinate these with a right atrium and a right ventricle and a left atrium and a left ventricle, you start to see that the heart is actually set up as 2 pumps, 2 circuits that we are changing and creating these pressure gradients to move blood to 2 distinct places. So like I said, we have the right pump, right atrium and right ventricle, and we have the left pump, left atrium and left ventricle. So let's look at that. So let's look at these 2 sides of the heart, and then we'll look at our 2, put them together and look at the 2 pumps of the heart, the 2 systems or circuits of the heart. So we look inside the heart, we can see here's the right atrium and here's the right ventricle. And like we said, that the atria are receiving chambers. So blood enters here from the vena cava, falls into the atrium, falls into the ventricle, and then the right ventricle pumps the blood out of the pulmonary trunk, or out into the pulmonary trunk. Pulmonary relates to the lungs, so the blood exits here. Remember, it's an ejecting chamber. Ventricles are ejecting chambers to the lungs. Then we have the blood now being oxygenated. It returns from the lungs into the pulmonary veins, and it gets, once again, when it comes back to the heart, remember it comes to a receiving chamber, which is the atrium. In this case, it's the left atrium, which then it falls into the left ventricle. Remember, the ventricle is an ejecting chamber. And so then the blood gets ejected from the left ventricle into the aorta and then out to the body. So we see we have the right pump to the lungs, and we have the left side pump that goes to the body. And then from the body, it comes back into the right side, out to the lungs, back to the left side, out to the body. And so you get back to this cycle. So you can kind of piece this together and see our 2 blood flow circuits in the heart, or our 2 purposes of the heart. You get to see the 2 pumps of the heart. So first is we have the pulmonary circuit. So that is that is the job of the right side of the heart, sending blood to the lungs, of course, to get oxygenated. Then the blood comes back to the heart, to the left side, atria and then ventricles, to go out to what's called the systemic circuit, which is to the body. So the right side of the heart is what we can call the pulmonary pump, and the left side of the heart is called the systemic pump. So just so now we can kind of orient ourselves again, we started off with our first fundamental concept, which is that you must start with the electrical events to cause the physical events. What is the result of the physical events? Is it creates pressure gradients, which allows the heart to pump blood. And then finally, we get to kind of the summary here, which gives us the blood flow pathway, which we've already covered just to get to this point, but I want to make it really clear what is the purpose of all of these steps is to ensure blood flows one way out of the left ventricle of the heart. So what I want you to do is pause the video and see if you can figure out all of the structures of the heart. So you can see we're going to start with 1. And you can see we got 1 through 11. And just to kind of help you out here, I know that the image is kind of smushed together here, but structures 3, 5, 9, and 11 are valves. Structures 1, 6, 7, and 12 are blood vessels, and structures 2, 4, 8, and 10 are chambers of the heart. So I will go over these, but pause the video, give yourself a chance to try to figure this out, or use this as a little test to see how well you can remember everything. So of course you can see the right side of the heart is in blue because this is represents deoxygenated blood. The left side is red because it represents oxygenated blood, and because that's what happens at the lungs. The function of the lungs is to oxygenate the blood. So go ahead, pause the video, give yourself a chance to figure this out. Okay, so hopefully you've had a chance to look at this, spend some time with it. So let's go through. Let's start with step 1, or number 1. So this would represent, you see it's a vessel, so it represents the vena cava, superior, inferior vena cava. And you can see the deoxygenated blood comes from the vena cava into the right atrium, which is your receiving chamber. And then from the right atrium, it passes through the right atrioventricular valve, the right AV valve. And then from here into the right ventricle. Sorry for the little pause there. I just got distracted, so just wanted to make sure orienting everything correctly. So this is where we left off. 1, superior and inferior vena cava gets into number 2. Structure number 2, which is going to be the right atrium, and then it passes through the right AV valve, which is number 3. That's structure number 3, right AV valve, also known as the tricuspid valve, and then the blood falls into chamber number 4, represented number 4, which is the right ventricle. So you can see we have the right side, blood falling into the receiving chamber, the atrium, into the ventricle, and then from the ventricle, it's going to get hit with that electrical stimulation. It's going to contract, the volume decreases, the pressure increases, we create a pressure gradient, and so blood's gonna exit through vessel or valve number 5, which is the pulmonary semilunar valve, into the pulmonary trunk, the pulmonary trunk or pulmonary arteries, and it's going to get to the lungs where the blood gets oxygenated. So then once the blood is oxygenated, it's going to leave the lungs and return to the heart along the pulmonary veins. That's number 7. So once again, we're returning to the heart. So then the blood's going to get to a receiving chamber, which is number 8, which is the left atrium. The blood then is going to pass through the left AV valve, also known as the mitral or bicuspid valve, into the left ventricle, which is number 10. When the left ventricle contracts, we're going to create that pressure gradient. Blood, of course, moves from the area of high pressure to the area of low pressure. So it's going to exit through the aortic semilunar valve into number 11, which is the aorta, and then out to the rest of the body, where the body's cells and tissues take out the oxygen. We now have deoxygenated blood returning along these systemic veins, and then the cycle starts all over again. So let's put it all together. If you are wanting to answer this question, why does blood flow through the heart? What we just saw in step 3. Why does the blood always flow in those steps 1 to 11? Well, long sentence here, but this is how I would answer it. The electrical stimulation causes physical contraction, which decreases the volume of the chamber, which increases the pressure within that chamber, which causes a pressure gradient between 2 areas, which causes blood to flow from the area of high pressure to the area of low pressure. Long sentence, but you get to see the very stepwise relationship between all of these structures to ensure that blood flows one way through the heart out of the left ventricle. So just take a moment to kind of process that. And then what makes it work really nice is when we look from a homeostatic standpoint, what we've done up to this point is how everything works in a perfect setup, how everything is perfectly designed to work. But realize that while specific structures have specific functions, if you change the structure even a little bit, you change the function. It's going to get worse. So notice this, any change to the heart structure disrupts any step of this relationship. So here's just a couple questions to think about. I didn't cover this in the video, but as you read this chapter, as you study, see if you can answer these questions, or obviously come up with other examples. So when we want to talk about how the change in the structure of the heart can change the function, think about how mitral valve prolapse would affect this above relationship, this one-way flow of blood through the left ventricle. Think about how decreased stimulation from the SA node, that's then electrical stimulation. Think about how decreased stimulation from the SA node would affect this function. Or another example, think about how increased systemic blood pressure would affect this relationship. These are all structural changes that are going to influence and disrupt the one-way flow of blood through the heart out of the left ventricle. So thank y'all for listening to this video. Certainly we covered a lot. I'm not expecting this video to answer all of your questions, but this should at least give you a framework before getting into the nitty-gritty of this chapter that gives you that anchoring point. Like I said, when you get lost, come back to this video, gives you a chance to formulate some questions and try to reorient yourself as to what is the purpose of everything that you're reading about in this chapter. So feel free to reach out if you have any questions. I'll be happy to post another video or help out in any way that I can.